And now it is my pleasure to introduce Dr. Andrew Louie. Dr. Louie is a clinical professor and vice chair for faculty development in the Department of Physical Therapy and Rehabilitation Science at UCSF, University of California, San Francisco. He has a doctorate in physical therapy and is a certified strength and conditioning specialist. Dr. Louie cares for patients with a variety of orthopedic and neurologic conditions and has worked in collaboration with the UCSF Department of Rheumatology since 2012. He currently teaches entry-level and postdoctoral physical therapy students in the joint UCSF and San Francisco State Doctorate Program, where he himself received his own master's and doctorate degrees, as well as teaching in the UCSF residency program. Dr. Louie serves on SAA's medical board and on the Arthritis Foundation's expert panel for axial spondyloarthritis. Welcome, Dr. Louie. We're so excited to have you here with us.
Thank you very much for the wonderful introduction, and welcome to everyone. It's interesting, I can't see anyone, which is good and bad, but I'm hoping this is coming through loud and clear for you. And thanks for sticking around to hear this talk. I hope it's beneficial for you. It's very funny listening to Aline read all those credentials. It makes me sound very important, but I don't know if I am. I do very much enjoy working with the people that I do, including people who have spondyloarthritis. And it's a little bit hard for me to sit here and pretend or say that I'm an expert, but I do feel like I've had a little bit of experience, and it's taught me a lot. It's really given me a chance to work with some wonderful people and learn from them as well. So again, thank you for spending the time with me today, and I hope this is useful for you. And yes, I am very interested in having you guys please enter in questions into the Q&A format so we can have a lively discussion. I feel a little silly lecturing to you guys. I do that to students all the time, but I still hope that there's some benefit for you guys as well. Okay, so anyway, thank you for the honor of being here, and we'll get started. Now, let me go ahead and share screen and make sure that we're going. Is this looking okay, Lee?
Looks great.
Okay, thank you. Sorry, I won't interrupt you more. Okay, so our topic for today is key topics in exercise and physical therapy for spondyloarthritis. And just to start us off, I will just quickly say that I don't have any financial disclosures to speak of with regard to this talk. And I want to just go over sort of what our sort of roadmap will be for today. Today, we'd like to make sure that we have a good understanding of the benefits of exercise for people with spondyloarthritis. I might take a little shortcut if that's okay with everyone and just call it SPA. I tend to get tongue-tied when I'm using long words like that, so hopefully we'll all be on the same page. Secondly, we want to make sure that we are relatively clear as much as we can be when we're generalizing anyway, of what people with SPA can expect from exercising. So, you know, what is realistic and what's not realistic? Third, we want to take a little bit of time to talk about what a good exercise program for people with SPA might look like. Is it the same as somebody else's, or is it very different? And we'll talk a little bit, again, using our current research to kind of give us the best understanding of what that might look like. We'll also want to talk a little bit about common exercise, what we call pitfalls. You know, those things that get people trapped. You know, what happens when people exercise and it doesn't go the way they planned, and maybe some strategies to how to either dig ourselves out of that pit or actually just try to avoid them altogether. And lastly, I can't help myself but put in a little plug for what physical therapists can hopefully help people with SPA with. You know, what does that really look like? I'm imagining that at least some of the audience out there has done physical therapy or worked with a physical therapist before, and hopefully that's been a positive experience. And even if it has, you know, what are the expectations that people should have if they engage with a physical therapist to make sure that they're getting the best care possible? So that's kind of our wrap up, and then we'll have the Q&A. All right. Before we begin, I just want to make sure we're on the same page. And you know, if you spend the time to look through research, you might have come across a couple different terms. And for most people, it's these terms might be interchangeable. You know, when you might say use one term and then use another, and I try to avoid that just because that sometimes can be confusing. But the thing that we want to know about is that actually physical activity, or some people abbreviate PA, and exercise are sort of classified and defined differently. And the importance is not to is mostly that when you look at studies and research, you might see different findings for physical activity or PA versus exercise. And this is true not only for people with SPA or the SPA population, but also in general. So I think it's good for us to kind of make that distinction just so we know what we're reading and what it really means to you and I. So by definition, physical activity, or PA, is movement produced by muscles that results in energy expenditure. So that's nice and general, and sort of just a catch-all phrase. And if you wanted to get more technical, you might divide those physical activities into different categories: work activities, transportation, domestic, and leisure. So that's sort of this all-encompassing. And I hate to bring back Algebra 1 for everyone, but I can't help it. My son is in high school, see, so it gives me sort of flashbacks as well. But if you remember those diagrams, they call Venn diagrams. They have this sort of way of representing information or concepts. And here the idea is physical activity is this broad category of those movements we just talked about. Now, what distinguishes exercise from physical activity is that exercise is a type of physical activity that, as you can see here, let's see, there's my cursor, planned, structured, repetitive, and specifically geared toward fitness. So if we use a very, algebraic kind of way of looking at things, we'd say that there's lots of physical activities, but not every physical activity we engage in is exercise. And likewise, every exercise we engage in, however, is a type of physical activity. So my best example to kind of clarify the differences is if you're someone who likes to do maybe a recreational sport like tennis or golf, almost everybody would agree that would be a leisure type of physical activity. But most people would probably say that golf or tennis, at least the casual game, would not be really considered exercise because it doesn't have these characteristics. And again, as we'll talk about in a moment, the deal is that when they do research, they look at physical activity and exercise sort of differently. And as a result, as a result of that, the findings are different as well. So we have to interpret those not with caution, but with just a little bit of intent, if you will. Okay. Boy, I wish I could see you guys so I could see if I'm going too fast. I'm going to talk a little slower because I feel like I'm talking fast. But the other part that we want to go talk about before we go deeper into our discussion today is that we'll be mostly focused on land-based exercise today. And for those of you who have the opportunity to work, to exercise or do activities in the water, don't stop, not really. There's no, we'll talk a little bit later on if you guys have questions, but the good news is that exercise programs performed in water and on land are beneficial. The reason that we tend to focus more on land-based or non-water exercises is just accessibility. Most of us don't have as much access to water as we do land. I have a good number of people I work with who have pools outside in their own home, which is just amazing. But even in sunny California, there's only a limited amount of months per year that it's actually doable or feasible to go into the water. So it's not that water exercise is not helpful. It's just for reasons of access and being as equitable as possible. We talk a lot more about that. And as we'll discuss a little bit later on, there's probably there is more research on land-based exercise than aquatic. Not by a lot, but definitely there is more. So we think we'll focus on that today. I'll just add my little aside there, if that's okay. I'm also not really as skilled in water exercises. Number one, I'm a terrible swimmer. And number two, we don't have the facility here. So as you can tell, it's probably not in my wheelhouse to really give you the best advice. So we'll stick to land-based exercise if that's okay today. Okay, so let's start off with our actual objectives today and where we're trying to go. Today, we want to start our talk by talking about the benefits of exercise for spondyloarthritis or SPA. And so here, what we know is pretty much something that I think most of everyone knows, but we'll kind of narrow it down in general to actually apply to the people who have SPA. Okay, so forgive me if this is review, but I just want to make sure we're on the same page. And I'm also sorry that this thing pops up and it's a lot of stuff to look at. I'll walk us through as carefully as possible, so hopefully it makes sense. Okay, the first part is probably no surprise to anybody. I'm sure by now you've heard this saying, sitting is the new smoking. Well, that's really true. And by that, we mostly mean that lack of physical activity or lack of PA is harmful to basically everybody, but especially people who have SPA. Okay, it's clear from when you look at research that if someone is not active, their physical function, what they call disease activity in the case of SPA, pain, stiffness, spine mobility or movement, heart and lung function. Basically there's no good that happens when we aren't active. So when we're sedentary, it really is harmful. And probably here, I'll conjecture by saying that, yes, it's harmful for everyone, but especially people with SPA. And we'll kind of tease that out in a moment here. Okay, going on to the second level, we also have some information that people with SPA tend to do less exercise. Now, I want to stop anybody from, I might get a barrage of comments there. There are plenty of people with SPA who do more exercise than other people, and certainly even more than me. I'm not that big on exercise. But if you look at the overall trend, if you looked at the studies, they do have evidence. Now, interestingly enough, people who have SPA, if you look at, again, at this general population, people who have SPA actually are active most of the time. Most people are active. But those, they're not as active, or they don't do as much exercise as the general population. And not surprising to most of us, the people that have more severe symptoms related to SPA tend to do even less exercise. I mean, that's like the no-brainer of the century, but it's true. And it gives us pause because those are the people that we really want to have do exercise. So we have to be thoughtful about how to approach that. The third part here, and this is maybe something that you may have thought of or maybe not, in that they found that while physical activity obviously improves people's health, both with and without SPA, it's also clear that exercise, remember that sort of narrower definition of physical activity, that exercise is actually more effective than PA in improving their health. Okay, so it's better to exercise than it is to only do PA. But that said, if you can only do PA, then it's definitely better to do that than nothing, if that makes sense. And our final conclusion related to all this other data here is that that's hopefully there's not overload here, but the idea here is that exercise is not only important, but it's a mainstay of treatment for people with SPA. And it's so much so that there was a pretty important paper that came out, and it really was sponsored by the American College of Rheumatology and the Spondylitis Association as well. They really put all their wonderful minds and resources and power together to come up with these treatment recommendations in 2015. And exercise is one of those mainstays. It was considered important enough to be in this, and the benefits are clear enough that it is something that has to be part of the treatment regimen, if you will. Otherwise, we're failing to deliver the care that we need to. Okay. Now, 2015 is a long time ago. I mean, to me, it seems like just a little bit of a while ago, but it's actually 7 years old. They did do a recent revision in 2019, I believe, or closer to that. But as it turns out, the literature and research on exercise subsequent to 2015, there were no new conclusions. So therefore, they left this recommendation standing for exercise being a mainstay of treatment. Okay. And again, the emphasis was on land-based just because of accessibility, not because of efficiency. Okay, hopefully that makes sense. So what about those benefits? What does it really mean to someone who has this diagnosis? Well, first of all, the good news is that people who have SPA still have or appreciate or can experience direct benefits of exercise. And that means actually improving the thing that they're working on. So a person with SPA still can improve their strength, their flexibility, and their conditioning endurance if they engage in those exercises. Now, that said, that's not to say that everyone can become, a Michael Phelps or some other famous athlete. It just means that with exercise, someone can improve these areas. Okay. Now, there's also might be a ceiling effect depending on how someone's built, what disease process is going on, their symptoms. So it's not that everyone's going to look like this gentleman here, but they can improve these specific areas. Okay. The other thing to notice, and I actually will apologize, there's one part that I didn't hear that I want to talk about, but from the many reviews and research, they've clearly proven that there are also indirect benefits of exercise. And they call it this burden of disease. You see this kind of frequently throughout the studies. And they'll say that pain, stiffness, and fatigue, the very common symptoms that people with SPA might experience, this is also, exercise is also helpful for reducing these as well. Now, again, as we'll talk about, it may not be that we can get rid of every bit of those symptoms, but it's that it reduces that to some extent. Okay. Now, the other part that I want to add in there, and I didn't do it earlier before I submitted these slides to Aline, was there's also very clear benefits psychologically with respect to mood, for example, and other feelings that go along with, the symptoms that people experience. For example, it's also clear that when people exercise, their sense of self-efficacy or the feeling that they can do something about their situation also increases. So those indirect benefits also span to mood and psychological aspects of ourselves as well. Okay. So now that we've established this is good stuff, what about the experience? What do people actually feel when they do exercise if they have SPA? Well, I'm a natural cynic. I mean, I feel like that's the way I was born, and I have a child who's also the same way. So maybe it's a genetic thing, but maybe it's not. Maybe it's just my attitude. But I always look at the negative first, and it's just the way I am. But if we had to look at the negative, and maybe there's probably a lot of optimists out there, but if we had to look at the negative, we have to say with honesty that when someone exercises and they have this SPA, right, they have spondyloarthritis, we can't really say and promise and expect that the exercise is actually going to stop the disease process. That would be unfair, right? That's not likely to happen. And as probably most of you guys have figured out by now, it's also not really fair to expect a complete elimination, a complete deletion of pain, stiffness, and fatigue overall. It's probably also really unfair to expect, or for someone to, well, it would be unusual to experience a reversal of fusion or other structural changes in our bodies with respect to the bones and joints and ligaments and tendons. So we're not reversing things. And we know, even for people without SPA, that there are things that make exercise hard or make it more difficult or challenging. Whether that's not having enough time, having difficulty with access, sometimes feeling not motivated to do something, adding another thing to our already complicated lives. And then you add on top of that, the fact that people with SPA, at least some of the time, may have pain, stiffness, and fatigue that is significant. Well, that feels like another thing that just makes it so hard to think that, yeah, I really need to go for a walk or get on this treadmill or do my core exercises or do my stretching. There's lots of things that make it hard to implement and hard to stick with. On the other hand, there's lots of good evidence for the benefits, and we'll talk a little bit more about that. But more importantly, it's beneficial physiologically, but it's also beneficial when it comes to things like quality of life and what people can do. And so if you really think about what we want people with SPA to experience with exercise is that they feel better. We talked about this reducing or managing pain, stiffness, and fatigue. We think this will translate to being able to do more things, to just do their lives, people's lives, like they did to the extent that they can. This includes work and leisure activities. And hopefully also we're doing our best, and what people experience is it just hurts less. It feels less stiff. It feels less fatigue. And there's also what I would call physical physical benefits, better posture, better spine mobility. Not perfect posture, not perfect spine mobility, but more better than they would experience without doing exercise on a regular basis. And for me, I think this is really important because when I first started working with people with SPA, I was very worried. I didn't know that much about it, to be perfectly honest. I had a really awesome set of mentors. But I was worried, what if I do something wrong and I tell someone to exercise and they get worse? And that was really, kind of intimidating at first. And the good news is that as I started to do more research and I've gained more experience and learned from people with it, they kind of showed me what it was like. Working with Dr. Gensler at the AS Center or SPA Center, they found that there isn't really evidence that people will make themselves worse when they exercise, even at somewhat higher intensities, depending on the person. And even more important to me was that there's been no good evidence to suggest that exercising will start a flare, because that was the one thing I was also very worried about. What if I spark something and do something that will be harmful? That would feel terrible. I'd really not want to do that. And so far, we really don't see that when we go through studies. Okay. So now we've talked about how awesome it is, and you guys have heard this before. I mean, I'm pretty much sure I'm preaching to the choir, as they say. But what does it look like? What is this program, this perfect program that everyone's gonna, get started right away, or starting now as I'm talking? Well, not really, but what are the program look like? What is different? And is it different from a good program for somebody else who doesn't have SPA? Well, again, I start with a negative because that's the kind of person I am, sorry. But there's actually not much agreement on the best exercise. There's been plenty of research on aerobic activities, and we'll talk about that in a moment. There's good research on core stability and strength training exercises. There's also one of the more sort of traditional things that people prescribe even way back when, before they really did efficacy studies, has been flexibility and mobility exercises because, well, you know, you're stiff, so you should do something about that. And then there's a little bit more trending nowadays is mind-body, so-called mind-body programs, which usually in research world includes things like Tai Chi and yoga, but there's obviously more things than that. So yeah, they're all good is basically what we'll talk about in a moment. There isn't this one thing that you need to do because you have SPA. It's more like, how do we put a good program together? So on the one hand, there's not really an answer, but the good news is we have guidelines based on all the research. And we have, I guess we would say that people with SPA have carte blanche to kind of make up their own recipe of exercises that works for them. And that's kind of what I really like to talk about. So, but if you thought about a generalized guideline, or at least a starting point, then we have these principles. And the three principles here are really that we want whatever exercises you guys choose to do to be sustainable, to be balanced, and to be individualized to you. And those are pretty, you know, universal concepts. You would see the same sort of approach, if you will, for multiple diagnoses and people who are basically without diagnoses. So sustainable, you and I would think about safe, enjoyable, accessible. Those are things that contribute to someone being able to stick with something that they want to do. And balanced, I'm sorry for the slightly the deceptive figure here. I don't mean that you're working on balance, although that's a good thing. I mean balance like there's an equal or there's a good mixture, if you will, of different types of exercises that address someone's needs. So aerobic, strengthening, stretching, and again, mind body, we can talk about that. We'll talk about that later as far as being able to mix those proportions up so that it turns out to be something that really speaks and resonates with you. And finally, we want to individualize. So that means taking into account someone's preferences and sort of what motivates them. Again, taking into account those symptoms that people might experience, pain, fatigue, stiffness, a whole host of other things. Taking into account someone's physical abilities, you know, what is going on? Maybe there is some fusion down in the sacroiliac joint that, you know, we can't really reverse. Well, we'll need to take that in consideration when we design this program. And then the interesting thing is, and this is, it goes back to what's true for most people, but basically the idea is that everyone responds to exercise differently. So what might work for somebody with a very similar physical makeup, if you will, it works for them, but when you try it, it feels just terrible. And that's the sort of the nature of the beast, if you will. It's not really specific to people with SPA, but it's kind of just in general, people have different responses to exercise. So it's not like usually we can just say, you know, based on what I see today, I will give you this and I'll just walk away. It's more like that's why we actually have ongoing visits, as we'll talk about, to make sure about someone's response and make sure that we can tailor the exercise program to fit the person, not make that person fit the exercise program. Hope that makes sense. Yeah. So if it's okay with you, I might throw some information here and I'll try to talk about it. It might be a little heavy, sorry. I think you'll get the general principles and I'll try to stay at that level. But when it comes to more specific recommendations, there's good data about this. Now, I'll put this out there, but there's a caveat here in that this is just a baseline, a starting point of how we think about different types of exercises. It is not like if you don't do this, you are a bad person. There's one thing that we need to rid ourselves of or dispense with is the idea of not complying with this recommendation means failure. And that's absolutely not true. But we should start with guidelines because that kind of gives us the best starting point, and then we adjust our expectations and the program itself depending on someone's needs. So let's just go back to our basics and make sure we're on the same page. Aerobic exercise is any exercise that's sustained and it winds up elevating our heart rates and really respiratory rate too, and uses a good majority of our muscles in our body. Okay, so I think everyone kind of is familiar with that. Most people think, you know, walking, treadmill, you know, elliptical, that type of stuff. We can definitely use this general guideline here as a starting point. And there's a couple points I want to make to be clear. Now, one thing is we break down aerobic activity into moderate or vigorous intensity, meaning how hard you're working. And for some folks, vigorous is great because they get a really efficient workout. As you can tell here, the amount of time that you need to spend doing a vigorous routine and the number of times you need to do it per week is less. So kind of bang for your buck. On the other hand, some people don't feel good when they're doing this, right? So that's not the way to go. They might do what's called a moderate intensity workout. And so you got to spend a little more time when you do this moderate intensity workout and do it more often, but there's still equal benefits. In other words, moderate or vigorous, you will still see the benefits that we've mentioned earlier. So that's good news for those people who are not into like running really fast. Like I don't like doing that. The other parts that I want to discuss quickly is what does this mean by this 4 to 5 out of 10 effort? Well, there's something kind of cool and kind of fun that someone invented a while back. I think it was a guy, but the name is Borg, and they call it the rated perceived exertion. This RPE is the sort of the acronym. And the idea here is that when we're honest with ourselves, we are actually pretty good at determining how intense we're working if we just consider how hard we feel like we're working. So for example, we usually say the scale is from 1 to 10. And one is we're binge watching on Netflix. Apparently there's lots of good stuff on there. I don't get the chance, but that's what we're doing. And then all the way to 10, we're running up Mount Everest with a 50-pound pack on our backs and a dog chasing us. So that's the maximum, right? So if you decide that I'm going to work out at a 4 to 5 level on that 10-point scale, most of the time, people are pretty good at mimicking what a cardiologist or a doctor would be able to observe by measuring their heart rate. And we'll talk about that. Likewise, on the vigorous scale, it would be 6 to 8 out of 10. And also people are very accurate when they actually sort of self-rate themselves during the workout. And you guys are probably familiar with this. I think, I don't know, it feels like everybody besides me has an Apple Watch or some other wearable device that tracks their heart rate. But the thing here is that everyone's heart rate, their maximum heart rate, I should say, is mostly determined by age. Obviously some folks who are genetically blessed have a very high maximum heart rate, more than usual folks. But for the most part, we can say that as we get older, unfortunately, our maximum heart rate decreases. But we can use that as to calculate. So if someone has a maximum heart rate of 200, let's just say, then if they wanted to work out at a moderate level, when they're using their Apple Watch, it should say that they're working between 64 and 76% of that maximum of 200. So you can kind of do the math, and there's lots of apps these days that make it easier to calculate, but that's kind of how that's defined. Hopefully that makes sense. And here, the other thing that we need to take into account, of course, like we said earlier, is that this is a starting point. There are folks who cannot do this. That doesn't mean that trying to do aerobic exercise is a failure. Okay, you will still see benefits. In fact, they've shown that people can exercise as short as 10 minutes and still appreciate benefits in their aerobic capacity and reap some of the rewards. Now, of course, we know it won't be as much as someone who can comply with this, but it's still significant. It still makes a difference. The other part to consider is that when people have a flare, your pain, your stiffness, your fatigue, whatever, some combination starts to come up for no good reason, like it tends to do, then we just adjust. That might not be the time you go for even a moderate intensity. You have to kick it down a notch. Maybe it has to be shorter. Maybe it has to be less times, or maybe it's a complete break for a short period of time. That is okay. The good news is that if you do have to do that, when you restart, you might have to start, not all over again. You might have to start a little less than you did, but usually people have a sort of a rebound effect or a muscle memory effect where they can get back to where they were quicker than if they hadn't been doing it consistently before. Hopefully that makes sense. Now, if we talk about strength, most of us are pretty familiar with that, but by definition, it means when we do talk about strength exercises, we're talking about muscles holding or moving against resistance. And here, we can also talk about these different levels or sort of different backgrounds that people have. So number one, what do we mean by when we're trying to describe how hard someone's working out? What does it mean 40 to 50% max? Well, this is what they call the 1 repetition maximum. You might see it in literature as called the 1RM. And that's the most that someone can lift for a particular movement. So I can, pick up this thing and lift 50 pounds. Well, I can't really, but pretend I could. That would be that's my 1 rep max. The most I could do is that weight 1 time. So if I haven't had more 6 to 12 months of recent weightlifting experience, then I would say the amount that we're shooting for as a goal would be about 40 or 50% of that. So if it was 50, it'd be, maybe 25. And we would see good benefits with that. For someone who has been doing weightlifting or strength training for more than, or for 6 to 12 months, then they can go more, they can use more and reap the rewards. So the other part is if that beginner person wants to start out, they might just start out with 1 set of 10 to 15 times, and that will be sufficient. While the non-beginner gets to do more, and they'll get more benefit from it by being able to do more. Okay. And interestingly enough, as far as how often, both characters, no matter who they are, they don't really need to do each body part or each exercise more than a few times a week, 2 to 3, maybe 4. That's because we need that rest time in between strengthening exercises for the body to recover and adapt to the stimulation we've given it. So that's something to note right there. One of the take-home messages I hope you guys got out of this, so if you look at it, is that we don't really need to use really, really heavy weights to improve our strength. And that's very clear because if we take the example also, or the different type of strengthening exercise, we talk about, core stabilization, those bridges, those bird dogs, those planks that people like to do if they can. It's not really that you're doing a 1 repetition max on that, really. It's more like you're working on endurance. You hold the plank for, 30 seconds, and then you work up to 35. You still improve strength. And so strength is a little bit of a deceptive phraseology, if you will. But if you talk about your muscle performance, that increases even if you're not lifting the heaviest weight possible. In fact, most people don't do that because there is an increased risk of injury as we go really, really high in our weights. So that's very important. And like we said before about aerobic activity, there's often times that we need to modify if someone is experiencing a flare or their symptoms just simply don't let them do that particular movement or exercise. So I think there it is a matter of that individualization, sorry, that we talked about earlier. Not only at the moment, not only for one moment, but that might change over time. And we just need to be responsive and thoughtful about that. Okay. I'll end with the idea of stretching exercises. And there, most of us are pretty familiar with that. We've done some form of it in the past before. It just basically means moving muscles and joints through the full range of motion and really designed to address flexibility and stiffness. And so I don't think there's any real surprises here for most folks. There is a lot less quantitative information on stretching and mobility exercises, or flexibility exercises. For example, they don't have really a good way to say this is how hard or intense the stretch should be. They just say it's moderate. Again, the good news for us though is that we're pretty good at that. Where if someone says or gives someone an instruction to do a moderate stretch, it's pretty easy for most folks to kind of do that very consistently and reliably. So there's no reason, in other words, to really stretch it to the point of pain. That's probably not in our best interest anyway. And the good news, a lot of people will have told me that they feel like they can do stretching exercises a little bit more regularly, even when there's a flare. Now, I know there's probably people out there that says, "Oh, that's not true at all. It's the reverse." This is a very generalization, a very general kind of statement that I've just come up with from basically working with folks. So take that with a grain of salt. But the part that I would draw your attention to with respect to this chart is that while we don't have a good quantifiable way of saying this is how hard you should stretch, what seems pretty clear is how much and how often. So I think the thing that I see most people falling into is they hold a stretch for like 5 seconds and then they move on. So it's been shown that we need to actually hold the stretch for at least 90 seconds. Now, I know you see, wait a minute, it says 2 minutes. Well, let me tell you, as someone who doesn't like stretching myself, but I need to do it, I say 2 minutes, people do 90 seconds. You know what I mean? It's gonna get shorter. So anyway, as close to as we can get to 90 seconds to 2 minutes is going to give us the best effect, that sort of return on investment, if you will. And it also needs to be done regularly. Less than 3 times a week tends to be not very efficient as far as actually getting the benefits we're looking for. Okay, so hopefully that gives you a little bit of clues. But we dumped a bunch of information on you now, and how do we put it all together? There's like so many slides. Louis, what are you going to do? How are we going to make sense of this? Well, I will try to just talk about it pretty simply here. One is, what are we supposed to do? And that, like we said earlier, it is that combination of aerobic, strength, and stretching exercises. And really, the selection, meaning the combination of how much of each, really depends on your goals and your status and kind of who you are. The second thing is, which type of aerobic exercise, which type of strengthening? Is it the TRX? Is it a therapy? Is it the rubber bands? Is it free weights? Is it machines? Is it stretching like you're doing yoga, or is it stretching like you're doing specific, stretches given by physical therapists? That all really very much depends on that person, each individual. Like we said earlier, there's no proof that one is really better than the other. So it gives us that carte blanche we want to select something that we actually like. We'll talk about that later. When? Well, the good news is that while we will say that there's some evidence that exercising in the morning is better for blood sugar control or something like that, the bottom line is it needs to be done regularly. We know for sure that consistency is the biggest thing that you and I can do to really reap the best benefits of our exercise program. So I always say anytime. I say whenever you can do it and you can do it, that's the best time to exercise. 3 to 5 sessions per week is kind of where, if you consolidated all the information we just looked at, that's kind of the answer you would come up with. Is less still helpful? You bet. Even 1 time a week. But we get that return on investment most when we do 3 to 5 sessions. And then how we talked about moderate intensity for the most part, for most folks. Again, this is very general, but hope it's true for most, is that moderate intensity of stretching, strengthening, and aerobic activity is usually the most easy to stick with. And if you're one of those people that can do vigorous stuff and it feels okay, then I say if vigorous is okay, then it's okay, really. It seems like we put things together, 20 to 60 minutes is sort of our average amount of time that we would devote. But the good news is it doesn't need to be just an hour block. Again, unless we're looking for Olympic level performance, regular folks like you and I, well, we can put it anywhere we want. We can literally do pieces here and there. Maybe you need to take a break from your Zoom calls like I do, and you need to just stretch for a little while. That still counts. That absolutely counts. So ideally, you can get through your exercises through the day, as long as it's done between this period and this period where you're awake, then I think you can feel justified in doing so. So yeah, maybe some folks do it better at the gym, but other folks need to do it throughout the day. I don't think we should feel guilty about that at all. Okay. All right. Now safety, I'll just do it really quickly here. I think most of us kind of know this already, but it's always good to be on the same page. The bottom line here is that if we're thoughtful, we consider sort of our true status of what's going on, our bone, our heart and lung, our joints, our tendons, our ligaments, and we consider our balance, mobility issues, then we're going to come up with a safe program. It's only when people sort of ignore the, common sense, is that really common? But if they don't consider whether or not they're overstretching joints and soft tissue, and they don't consider if they're doing extreme motions, very high impact activities, or something with a great deal of force, then that's when we get into trouble. So, it's not really possible for me to say that this is an absolutely wrong exercise for someone to engage in if they have SPA. Right. But I am thoughtful that it certainly wouldn't be the first thing that I ask someone to do. I mean, if you look at her wrists, for example, my wrists don't do that. I don't know, maybe some of you guys do, but it doesn't. And then I don't squat. If I squat down this low, I'm not getting back up, not without somebody, my son, helping me. So, again, could this be done by someone with SPA? Maybe. Is it my first choice to go to? Probably not, because of this consideration of overstretching joints. And, maybe it's a lot of weight. That looks like a lot of weight to me. And likewise, can someone do this? Maybe. Is that the best return on investment, or is that the best, actually a better, how do I say, a better business analogy might be risk benefit ratio. Is the risk high and the benefits are higher? Well, maybe you'll do it. But if the risk is high and the benefits aren't that much better, why would you consider going into this pose during yoga? So hopefully that's kind of, one of those kind of obvious things that we can talk about, but I always think it's good to be on the same page when it comes to safety. Okay. All right. Now we're getting to the point of talking about pitfalls, the sort of sand traps, if you will, where people, good people like us, we say, we're going to start an exercise program. So-and-so said so, and that's Dr. So-and-so said so, and it's the right thing to do. I just read about it somewhere in the SAA, .org website. So of course we're going to start. And then what happens? Well, sometimes it doesn't go the way we expect or we want. And I think that's just, humanity. I mean, it happens to me a lot of different things too. But let's talk about ways to sort of avoid or dig ourselves out of those little sand traps. Number one, trying to do it by ourselves. And this happens to me, not just in exercise, but other things in life as well. So I've learned that lesson the hard way. But by this, in respect to our talk today, I'm talking about choosing and designing the program. We think, oh, so-and-so said we should exercise. I'm just going to do it. And usually that goes to us saying, well, back in high school, I used to blankety blank. So that's what I'm going to do again, even though I'm, well past that. I think I'm past the 30-year anniversary. Don't tell anybody. And then there's the idea of people doing it by themselves, not just designing, but actually executing it. So for some folks, for a small minority of people, I'd say that works out really well. But for the most of us, that's not really going to give us the best chance of success. So I think it is a pitfall in that way. It's not that it's all wrong to design your own program or wrong to exercise by yourself, but it's the likelihood of success. I think it starts to decrease when we do those two things. So on the other hand, what might you do to engage with somebody to help you out with this and really build that program the way to be the best it can be? Well, a couple easy steps here. And I think I'm preaching to the choir here, but I like to remind you of it. So we're on the same page again. And that is, of course, the rheumatologist and your physical therapist are going to have hopefully the best information for you to say, this is what's going on with your body right now. And this is the goals that we think would be reasonably set for this. And you guys have probably heard this before, but they talk about, SMART goals. And by that, they mean specific, measurable, specific, measurable, attainable, realistic, and time-based. And that's also that we actually set goals that we can achievable there, and then can move on to the next one. Because doesn't it feel great to be able to say, I've met my goal here, now I'm ready for the next one, right? And so that doing that will also help us build an individualized program, because now if we know the goal, then it's easier to pick what we should do. And maybe it is a class that involves some Tai Chi or yoga, or maybe it's not. It really depends on that person. And then engaging with your team or not doing it solo also might mean having regular check-ins. Now, I'll tell you that my bias is that someday in the future, I hope that it'll be such that physical therapists get to check in with patients every year, just like they do a dentist, or maybe twice a year even. And I don't know how often people check in with a rheumatologist, but it'd be great for that just to be built in, so I really can do these regular check-ins, as we'll talk about. But those might be ways to engage in your team, with your team. Hopefully there is a way for you to have the resources you need to really figure out what's going to work for you. Okay. The other thing to talk about is engaging with others. And there's two ways that they talk about this in literature. One is the social context. Now, again, most folks, not everybody, will do better, meaning they'll work out more consistent, or they'll exercise more consistently and do it for a longer period, meaning like number of years that they stick with it, if they have a partner or partners. Or they might be the group exercise kind of person. They've also shown greater compliance or adherence, if you will, when someone has a exercise group. And now in the well, since COVID, honestly, but even before, this option of virtual, like we're doing now, can you have that sort of companionship or camaraderie with someone on Zoom if it's not feasible, they're far away? Yeah, the answer is yes. At least initially we think so. The other part to consider is what we call social support. So even if you are that person that likes to, I literally have a colleague who does this, they go out to the bay and swim by themselves. I think that's quite super crazy. It's freezing and I'm scared of seals. But anyway, social support, meaning even if they do that exercise or activity by themselves, having support from our family, our friends, our medical professionals, at the very least encouraging, and that most may be checking in and making sure and giving feedback and monitoring, those all matter. Those all help us dig ourselves out of the pitfall of doing things by ourselves and not sticking with it. So yeah, there's lots of ways to engage with our team. Pitfall number 2, making things too hard. And I'm pretty good at this too. I think it's the sort of cynicism part, but I'm really good at expecting too much, for example. Expecting our physical ability or our symptoms to get better after doing, 2 weeks of exercise, for example? What are those expectations? Or saying, oh my gosh, back before all this happened, I was able to blank, blank, blank. And now, I should be able to do that again if I start exercising. So, setting ourselves up for a little bit of not success, is put it mildly. And then thinking about, how many times, well, okay, so you click on a YouTube video and then boom, an ad pops up, right? I don't know how to stop that. I wish someone, maybe one of you guys is like super expert on that and can block it for me. But anyway, you click on it and you see an ad for something. And this time it's an ad for this particular awesome exercise device or class or something like that, Peloton. Oh, it's the most amazing thing. And it turns out that, maybe it's not as accessible. And maybe we don't like it. Maybe you don't like being on a stationary bike, no matter what it is. Or maybe it just like that particular machine or particular exercise really, irritates my SI or something along those lines. But we try to stick with it because, other people are doing it. Someone said it's awesome. So-and-so loved it. Or it's, I don't know, sometimes cheaper. Who knows? But, making things too hard, I think is again, one of those human condition things, at least for me. So how do we get around that? How do we avoid that pitfall? Well, as we talked about, kind of referring back to our SMART goals and our expectations, it's really about here, understanding what we should and should not expect. I think, as we mentioned earlier, it's not really realistic to think that things are going to change quickly. Physical function, symptoms, even our exercise habits are unlikely to change quickly. And that's just kind of how it is. If you looked at physiology, it's definitely true that even people who have zero disease, their bodies will take anywhere from 6 to 12 weeks to adapt to whatever new thing that they're doing. Stronger muscles, stronger and bigger muscles, more flexibility, better aerobic capacity, meaning you can run faster or longer, right? All those things will take at least that long for our cells, and down to the cell level, of actually adapting and changing, at least to a significant amount, right? So our habits, as you know, I think we have it easy if we're talking about exercise. I think the hardest thing is diet. I don't envy a dietitian's job trying to tell me not to eat things that I love, like, don't eat bacon, don't eat, Peking duck. Are you kidding me? I'm not going to change that. That's the hardest, right? So I think it's easier to change exercise habits myself. But the other part to think about here is imperfection, right? Are we expecting perfection? Are we expecting us to stick with a program and be flawless and never miss a single session over a course of time? I think we have to be just more likely to think, to expect imperfection and be okay with it, but also move on. And I really think we need to cater our exercise to ourselves, to really pick the things that are accessible and something that we get something out of, we really feel good about in some way. Whether that's just because it's a group that I really like being with, or because somehow it gives me a thrill. I have zero runner's high. I jog on a treadmill, the minimum amount, it hits 30 minutes. I'm stopping that thing at 30:01 because I don't really enjoy it, but it does give me the satisfaction that I did something right, and it's the fastest way to do it. That's the only enjoyment I get out of it, but still it's enough to keep me going, right? And let me tell you, in San Francisco, that's where I'm at. I have to circle around the park and the block to get into the gym. That is it. I am not going to be likely to do it very consistently. So we really do have to be honest about what we're willing to put up with and what we're really enjoying, I think, to really be successful. Okay, this is our last pitfall, and we're almost there, guys. I appreciate your patience. My students know that I drone on and on and on, but we're going to try to finish because I know we're almost out of time. Being our own worst critic. I'm also good at this. I'll just say that we get into self-blame and guilt or shame when we don't necessarily stick with the program. So I'm just going to go on to talk about the ways around that is usually identifying and addressing barriers and setting ourselves up for success. So instead of, as the slides talked about earlier, setting realistic goals and designing our program, the thing about it is just like any other health behavior, again, same thing as diet, there are barriers, things that get in our way. And it's really the physical therapist, the person, the rheumatologist, everybody's job is to help people manage those barriers, right? And figuring out workarounds that really are successful. And using reinforcement, it's been shown that if a person engages with somebody to have regular check-ins, as we talked about earlier, for that person to monitor what's going on and to provide feedback and guidance, that's how we really dig ourselves or avoid that pitfall. Okay. I apologize for going over time. So I wanted to end with this before we go. And that is, how do physical therapists help people with SPA? Again, probably most of you have engaged with a physical therapist before, but I'll simply put this up as sort of a reminder of sort of that process, the cyclic process of the physical therapist taking a look at you and measuring things and developing a plan by collaborating with you, by asking and hearing and incorporating your goals, your preferences, where you are with your physically developing a plan. There's an execution, but the adjustment phase or adjustment part to me is just as important as the developing and executing part, because again, most of the time, at least I am not so good that I can come up with a program with one shot and make sure it's perfect and have it stay perfect or stay appropriate without some reassessment, without some re-engagement. So I'll just say that. And the last thing I'd leave you with, is that when it comes to about our plan of PT, it is more than exercise. Although exercise is, like you saw, a mainstay, it's sort of like the bulk of what we do. We also want to help with problem solving, not only barriers to exercises, but just general life. You know, what are things that are hard to do? What is this disease, this condition, if you will, getting in the way of? And how do we do a workaround? How do we find equipment or adapt what you're doing and how you're doing it? And yes, there's a place for hands-on techniques, you know, soft tissue mobilization, joint mobilization, depending on the situation, that might work. But we also know that those hands-on techniques tend to be relatively temporary. And that's true for everybody too, whether or not they have SPA or spine pain or joint pain related to other things. So really, the ideal situation is for a physical therapist to help people with management. It is tweaking things to fit the situation and symptoms. Maybe there's a flare and you need to do something different. But there's also the idea of long-term coping, you know, figuring out all the long-term problems, the equipment, the adaptations, and the techniques that help people manage what's going on. So again, sorry for running over a little bit here. I'll just summarize here by reminding us that we've talked about how exercise is a proven way to optimize physical function and manage symptoms. We can say with good honesty that people can experience similar benefits from exercise as people without SPA. Now, it won't be the same, but there are similarities. Good programs should be balanced. They should take into account someone's unique situation, needs, and have that mix of aerobic strength and stretching exercises. And those pitfalls, I think the bottom line to take out of it is that if we set realistic goals and expectations, and we have a clear plan for staying on track, I think most of the time we can dig our way out of it or avoid them altogether. And hopefully that you can engage with a physical therapist that will really help you get started and stick with a program and adjust the program to really be safe and effective for you. So thank you all for sticking with me. Again, I apologize for running late. I just wanted to say hats off to the Spondylitis Association of America for always giving me these wonderful learning opportunities. Richard, Aline, Rachel have been indispensable to me. They're awesome. And my mentor, Dr. Leanne Gensler at the Department of Rheumatology and my department have been super supportive. So thank you to them. And thank you all for all of your patience and your engagement with this. I really appreciate it. I see 6 Q&As, so hopefully there's great stuff. And there's a ton of references if you guys decide to read stuff. I don't know why, you know, if you're that curious, go for it. There's lots of good information out there. So I'll stop there. And again, thank you very much.
All right. Thank you so much, Dr. Louie. What a wonderful presentation. We really appreciate your time, your energy, your expertise, and for making this so accessible and so relevant for our patient community. Thank you. We are now moving into our Q&A session. So if everyone, I do see a number of questions already. Thank you for those already. If you have not had a chance to submit your question, please do so now. You can enter them into the Q&A module at the bottom of your screen, and I'll read them out loud for Dr. Louie to answer, getting to as many as we can get. So, sorry, my screen is, okay, got it. Okay, accessing questions. Let's begin with this question. With AS, I find that I get sick very often, which causes me to fall off the exercise wagon. Any suggestions on how to keep an exercise program even in sickness?
That's a great question. Thank you. By sick, I'm going to sort of make a small assumption. If this is incorrect, please let me know. But by sick, I'm thinking fatigue, maybe more pain, more of the stiffness symptoms. And so I think a couple things that we talked about earlier. Number one is finding a way, maybe working with a physical therapist or your rheumatologist, to really modify what you do during those times. And if there's absolutely no way that you can engage with exercise there, I think that's okay. I think it's worth a try to make adjustments. And then when those in between times that someone has, much less symptoms, I think starting gradually and kind of progressively working their way up. Hopefully over time, what'll happen is, even if we go through these sort of roller coasters of, flares and no flares, that if there's enough time over the course of maybe a 6 months or a year, we'll get this sort of again, sort of this muscle memory effect, where it'll be easier to regain what we might not be able to do or have lost slightly during the flares. I hope that sort of answers the question. Do you think that's close, Eileen?
I think so, yes. I think that was very good.
Good.
Let me go to any thoughts on finding a PT practitioner who is knowledgeable in spondyloarthritis?
Oh, that's a good one. Yes. Well, my first response, and I've tried this myself actually, because sometimes I get to work with people who live very far away from San Francisco, and obviously I can't travel there. I think we have a couple options. One is if we go to the American Physical Therapy Association, what's called the APTA, you can usually look up practitioners through there. There's like a find a PT button, I think. And if someone has what's called an orthopedic specialist or is a clinical specialist in orthopedics, they are likely to have a little bit more understanding, because they're supposed to be focused on orthopedic, that is musculoskeletal problems. That's one way. Of course, that still needs a little bit of footwork from the person. And also, I honestly am an advocate for people to say, just call that particular office and say, does Dr. So-and-so have experience with people who have spondyloarthritis? And if they ask you to repeat it like 3 times, it's time to move on, to be perfectly blunt. The second thing that I do now, I think is useful, is, hopefully there's going to be some practitioners that you've seen or met through the Spondylitis Association. We're able to do, video visits now, right? So that's the good news. The bad news is, who knows if Congress is going to approve us to continue doing so. But I like the idea of being able to hook up with someone now remotely, because I think at least a chunk of what we can do can be done through a telehealth model. So hopefully there's more access that way. But honestly, the orthopedic clinical specialty, and then literally asking them, how many patients have you worked with? From a training standpoint, most physical therapists have the background to do it, but they may not, to work with people with SPA, but you may not have enough, notches on their belt, so to speak, of people they've seen to really have immediate understanding. I think that said, a good physical therapist will listen to the person and be able to learn with them, and be able to engage still in a productive relationship. Does that help?
It does. Thank you so much. That is such a wonderful tip to keep in mind. The APTA, find a PT option, and you mentioned orthopedic specialist focus. That's really helpful information. And one of the other questions that came in actually was about working with a PT virtually via Zoom or something like that, which you already answered a little bit. But if I can follow up, do you work with patients virtually via Zoom?
I do.
You do?
Yeah. I'm sorry. Did I cut you off?
No.
Okay. Sorry. Yes, we are doing that. I'll just say there's 2 caveats. One is now, for a little while, we were in a state of emergency with the COVID by I think federal government, and there they let us actually practice by seeing people out of state. They've since rescinded that. So now I can only work with, and this is true for everybody, at least in California, we can only work with people in state. So that's one thing. The second thing is, like I mentioned, they're questioning if they're going to continue reimbursing telehealth visits in the future. I've heard different timelines, like January or March. So if you guys have any awesome relationships with your Congress people, tell them to continue it. But I think many people now do telehealth visits, at least as a mix. I think what's happening now is what we call a hybrid, where there might be reasons to come in person so I can do a hands-on assessment to really understand what's going on. But once I have that understanding, people are so good when they describe their symptoms and their problems that oftentimes we could problem solve and demonstrate exercises through this medium, through the virtual medium with still good results.
Wonderful. Thank you.
Mhm.
Let me see. Here's an interesting, good question. Any
Okay.
specific AS exercise videos or links that you can recommend? And if I can be so bold as to point out just a couple of things that I know that SAA offers before handing it over to you, I'd love to do that. So SAA has two programs at the moment. We have our Back in Action Again exercise program. That you can find that on our website. I will put a link in somewhere for everyone to see that. And then we have recently partnered up with two spa patients themselves. One is a yoga practitioner, teacher, instructor, and one is a strength training specialist, and they are Spondystrong. So both of those exercise options are available to everyone on SAA's website. Other than that, Dr. Louie, any other specific suggestions, videos, or links that come to mind for you?
Right, that's great. Actually, I'm just going to amplify what Aline said. Those are the resources that I recommend for most folks. Shy of working with a physical therapist, if that's just not a possibility, then I often will go to the SAA resources, and I was fortunate enough to kind of have some input on that, so I feel pretty confident in what's described there. As far as specific exercises, like I said, there's really not enough data to say this is one great program. Every time I've seen a research study on a particular program, the program itself is not fully accessible, and it seemed to be not exactly what I'd call completely objective, in that there's people who are very focused on this particular exercise program. So I feel a little reluctant to advise people in the community to just go ahead and engage with that exercise. That said, again, core strengthening types of exercises where there's not a lot of twisting, there's not a lot of bending, but sort of a still and stable core spine, and flexibility exercises that don't put a lot of pressure on spine. The idea of not getting ourselves in a very bent or folded position or twisting excessively is probably my go-to. But as far as videos, I think I would stick with the SAA ones. I feel good about those.
Thank you so much. Let me see. What should we ask to when should we ask to see PT for when we are not having a specific issue, but we like to just see one to develop a program?
Oh, that's a great question. Thanks for asking that. I almost feel like I planted that one. I personally think that, working with with your rheumatologist or physician, I'm a big fan of tune-up visits if it's possible to do so. Meaning that I think, yes, absolutely, when you're having difficulty, managing your symptoms, or your exercise program is not meshing with what's going on, that's an absolute, now let's do a PT visit. But honestly, I think people also could benefit from, really an annual thing. So even if someone's feeling bored or tired of doing the same exercises, I'm still an advocate. The trick is that at least where in my practice, I have to usually ask a physician to write a PT referral or a prescription, if you will, to get started. But that said, I think a couple of visits, whenever you're feeling like you want to change your program, but you're unsure how to do so, would warrant another visit. At the very least, a phone call, maybe a couple of messages to say, I want to try this. Is that a bad idea given what you know about me? I think that kind of contact is very much in our wheelhouse. And I like to put myself, the people I work with, I kind of tell them I'm on retainer. I'm not sure if that's the right way in law practice, but you're just kind of on a standby, and whenever there's a thing, just reach out. And if we need to do a couple of messages, we can communicate that way. If we need to take it to the next level, ask Dr. Gensler to write me a new PT referral, and we'll engage again that way.
Oh, that's fantastic. Thank you. The next question, actually, this leads really well into that.
Okay.
Someone is asking, so they've been cycling for over 20 years. They're on a bike path 5 days a week for 30 minutes to 50 minutes at a time. A doc suggested that this is not safe because of fusing, and they would love your thoughts on continuing or not. They would hate to give this up. They feel it's relatively safe, but they would love your input.
Oh, thank you. Yeah. It'd be great to examine that person, but not being able to do that, I kind of with the person there, that the person that's biking. I think it's great exercise. If the worry is fusion, there's one thing that we can sort of dispel our worries, and that is, I guess I would agree with the physician or the other person that said don't do that, if that's all they ever did. So I'm
Mhm.
imagining someone who's riding a bicycle. They might have that really low position. They got a really racy, cool bike, and they're hunched over, right? Maybe that's not a good position. But unless that's the only thing they're engaging in, I'd be surprised if that led to an increased risk of fusion. So I would ask that person to continue what they're doing with their bicycle, which sounds great. I mean, I'm jealous. I don't know if I could do what they're doing, which is just amazing.
Yeah.
But I would say, hey, we know that if you are indeed hunched over and riding your bike, then let's do some mobility exercises to counteract that. Let's, stretch or move in different directions to ensure that there is no prolonged posture that may not be optimal. And then if that person also engages besides that in some flexibility, maybe a little exercise to strengthen the core, that's great. I think bicycle riding in general works the core in a very specific fashion, which is good. But again, we want that balance where we work muscles that are opposite of the ones we commonly work. Does that make sense?
Right. No, makes perfect sense.
Yeah, yeah,
And we're also talking about the concern of kyphosis, correct? If someone is
correct.
going to fuse to, yes, try and avoid that
Yeah,
postural impact.
right, absolutely. And so like if someone's on a bike, 24 hours a day, I'm like, yeah, that's a that's a bad thing. But if you're only there, I mean, we said what, 30 something minutes or an hour, was it, Eileen?
30 minutes to 50 minutes, 5 days a week.
Right. So that's a lot of time, but I think if that's still not every minute of the day. So
Right.
I think if we can work towards being in a very upright and good position the rest of the time, I think again, that sort of risk benefit ratio, it could be pointed in our favor, if that makes sense.
Makes sense. Yeah. Yeah. So to pay attention to some postural exercises possibly, and yeah, no, makes sense. Well, the next question again leads into that very
Mm.
nicely. Do you see that your patients with SPA, who are exercising or doing PT, that they're able to either stop or slow down progression of that kyphosis?
Oh, yes. The answer is yes. I mean, it's hard to say that I have a controlled trial doing that. The good news for us is that it feels very much like, and I joined the game late, but I've had several patients tell me, you should have seen me before, Andrew. I started all this treatment stuff. I was hunched over and I couldn't even walk.
Mm.
And once they engage with medication and exercise regimens, I really feel like, at least by their report, they say, you know what, number one, I feel way better. And secondly, I don't think that I feel like I was heading the wrong direction with my kyphosis, with my, my posture, and now I'm not going that way anymore. So I would say the answer is yes. Dr. Genzer has told me multiple times from experience, as well as her research, that the biggest risk of fusion is lack of movement. So
Hmm.
I think we can say with pretty good certainty to say that moving, exercising, etc., really does make a difference. It doesn't completely eliminate the risk, but I think it's what we can do. I think we say, gosh, if you're taking your medication regimen and you are engaging with your exercise, those are the controllable factors. The things that we can't control is the rest. And I don't know what else to say about that, but I think it makes enough difference to justify the time, the energy, and the commitment.
Thank you. Thank you. So we've spoken quite a bit about axial spondyloarthritis, which
Mhm.
makes perfect sense. Can we maybe speak a little bit about peripheral issues? So people who have like knee arthritis or arthritis in the Achilles, and some things are difficult for them, or maybe some things in their wrists and in their hands. What kinds of accommodations or what kinds of exercises or PT modalities are helpful more for the peripheral issues
Yeah.
that some people experience?
Oh, absolutely. Thank you for bringing that up. Yeah, I apologize for being so spine biased, but one of the things that we know is that people who have SPA will still have the likelihood possibly of having what they call enthesitis or tendonitis in the Achilles, in different parts of the shoulder, etc. And the good news is that the same principles really do apply. While aerobic exercise isn't necessarily going to stop the process, the stretching and strengthening things are also still going to be beneficial for someone. That said, with an active inflammatory process or inflammation of a certain tendon or joint, if you will, people still will follow through with, first resting and allowing that inflammatory process to die down, and then engaging with strength and stretching exercises. So the good news is that still seems to be very much the same formula. It's a different application. Obviously, the exercises will vary, and that's where you'll want to go to your physical therapist / rheumatologist / medical provider and really get a clear description of what you need to do. But the general idea there is, there's this time for anti-inflammatory measures, if you will, and then after that, strengthening and stretching should be something that reduces risk of future problems.
Wonderful, makes perfect sense. Let's see. So I have kind of a specific question. I'm going to try and make a bit more general here. So, so going back to when you had your great slides about the strength training and cardio training, can we talk more about those specific reps and maybe look at if there's a duration that you recommend a person takes to complete each rep? Or is that just kind of depend on where they are and what their specific goals are?
Yeah. The answer is both.
Okay.
Yeah. So if we're looking at specifics like how fast or slow the repetition, the lifting procedure actually goes through, I will throw out the general blanket statement that for most folks, the majority of folks, having a slower repetition, what they call cadence or sort of rhythm, if you will, is probably better just because of safety. It's easier for us to control the weight and our motion if we're not moving very quickly. So that's kind of the general idea. The tempo, if you will, they'll usually say it's a 2-2-1. So going up is 2 seconds, holding for 1 second, and then 2 seconds going down. Sorry, my arm is disappearing. But it's that slow. It's relatively slow. Again, the idea there is that it's easier for us to use good technique and not put ourselves in a awkward or uncomfortable position if we're using that sort of what they call tempo. Now, that said, there's plenty of people that their goal is to be what we call powerful. Power is the amount of force that we can generate at a specific speed. So usually it means like someone who's playing a sport, they want to be powerful so they can move quickly. In that case, they might take a different tempo and move relatively quickly. Maybe it's only a second down and a second up and no holds, meaning not holding it in that one spot for any time. That will really depend on their goals. If you're talking about the lens of someone with SPA, I don't know that there's any research to say that one is absolutely preferable. I think it really has to be that, does your body respond well to this particular type of tempo or speed? And if so, does that match your goals? And so I think it's very individual, but I hope that answers the question.
It does. Thank you. Thank you very much. Okay, let's see here. I'm going to try and go back to my slides here. Okay, it looks like we're actually running out of time and I'm on the wrong slide. We are. So I wanna thank you, Dr. Louie, for this wonderful Q&A session, this wonderful presentation. And just for so generously sharing your time and expertise with us. It's truly been a pleasure to have you with us today. Thank you for today and for all that you do for our community.
Well, thank you very much for the opportunity. And again, thank you all for your patience and engagement. I really appreciate being able to work with the community, and I'm maybe looking forward to some other times, but thank you all for your time.